You've seen these claims on a supplement label: brain support, focus, memory, nootropic. When a patient hands you a bottle like that, what do you actually say? Welcome back to Natural Medicine's Evidence in Practice. I'm Jeff Langford, a pharmacist and managing editor at NatMed.
And I'm Andrea Stafford, a pharmacist and assistant editor with NatMed. If you work with natural medicines or you're curious, you are in the right place.
On this show, we're going to cut through noise and trends to bring you practical, evidence-based guidance.
And more specifically, in today's episode, we'll be discussing nootropics, what they are, what the evidence actually supports, and the safety and interaction issues that matter in day-to-day practice.
And a quick note, CE credit is available for our podcast through our monthly NatMed newsletter. Check the show notes for how to claim it.
So, to get us started, I will admit I did not know the word nootropics at first. I did know about the products because patients ask for focus, memory, or brain boost supplements all the time. So, Jeff, can you get us started with that definition?
Yeah, and I'll say, Andrea, I don't think you're alone there. So I think that is a common dilemma with this term. It's first probably fair to call out that this is a term that we will hear pronounced a lot of different ways, including nootropic, 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 and probably some other variations as well. But regardless of how we say it, it's an umbrella term for smart drugs or cognitive enhancers that have the potential to support memory or learning.
Thank you, Jeff, for that definition. And once we hear that, you can probably guess what happens next. We immediately start thinking of the usual suspects we hear for memory or focus. And you really want to know what works. So today we're going to zoom in or narrow in on three: Bacopa, Ginkgo, and lion's mane. What they are, what the research shows, and which safety or interaction flags should kind of make you pause and get additional information. As we go, we will take ingredient by ingredient. We'll use the same framework each time. And our first step is going to answer an important question: what is the ingredient and what's the rationale for why it might support cognition?
Yeah, and then we want to follow up by answering, do these really improve cognitive function in people? Importantly, lots of different kinds of people might be interested in using a cognitive enhancing drug. It could be students or healthy adults that just want a boost or an edge. Perhaps patients with cognitive impairment, mild cognitive impairment, or Alzheimer's disease that also would like to improve their function. So, where it's available, we're going to separate that evidence out for both healthy patients and those with different levels of impairment.
Thank you for that clarification, Jeff. I think it's important to point out that the patient population these studies are in. From there, we will also review the safety piece because for some of these, the risk of side effects or interactions could outweigh the potential benefit.
Perfect. So let's take it ingredient by ingredient and get started with Bacopa.
Yes. So, starting with the basics, when we say Bacopa, we mean Bacopa monnieri. It's an herb native to India with a long history of use in Ayurvedic medicine. You'll often hear it called Brahmi, but that name isn't exclusive to Bacopa. It's also sometimes used for gotu kola. So, quick heads up: Bacopa is not the same as gotu kola.
Yeah, and there's interest in Bacopa for Alzheimer's disease, and some preliminary data seem encouraging. So, starting from this kind of, before we get to the people, we're going to think about animals or lab studies if they're there. And for example, in an animal model of Alzheimer's disease, a Bacopa extract increases some measures of memory.
And that's a great foundation, Jeff, because animal data can tell us something about its potential, but does that translate to humans? And as it pertains to human studies, Bacopa is one of the more studied memory supplements, but the results are mixed. In healthy adults, those without cognitive impairment, it hasn't consistently improved broad measures like working memory or learning rate. That said, some subgroup analyses have found improvements in more specific areas like reaction time or verbal learning. It's also important to note that the evidence remains mixed regardless of whether a patient takes it alone or in combination with other ingredients such as ginseng. So, the next question we want to consider is, what does the evidence say about people with cognitive impairment?
Yeah, so turning to that patient population, Andrea, the evidence is also somewhat mixed in those cases as well. So, for example, we have one clinical study in older adults with mild cognitive impairment, and in that population taking an oral Bacopa extract for about 2 months improved again some specific areas of cognition, like attention or verbal fluency, but not other areas like working memory. This was compared to placebo. So that was kind of a short term piece of data. We also had a longer term study in patients with mild cognitive impairment or Alzheimer's disease, used Bacopa for about 12 months, so longer duration here. But it didn't improve measures of cognitive function compared to their baseline performance or to using a traditional drug like donepezil. So we see some mixed results in our patients with cognitive impairment. That could be due to the different kinds of patients that were in these studies, how long they were followed up, or other factors like the Bacopa doses that were studied.
Okay, so if the benefits are inconsistent, the next practical question is what do we need to watch for on the safety side? So, Jeff, can you walk us through what to consider?
Yeah, so big picture, Bacopa is generally well tolerated, but it does have some common adverse effects, including GI upset. And other adverse effects like flu like symptoms, fatigue, and palpitations have been documented in some of these studies, but those things are fairly infrequent. So I think our bottom line here, Andrea, on Bacopa is that the evidence for cognition is mixed. Sometimes we might see small benefits in certain subdomains or submeasures of cognitive function, but that means often, for many people, there's no meaningful change.
So, I think if someone wants to try it, we want to set expectations and then monitor for side effects, especially those GI issues like cramps, diarrhea, and nausea.
Agree.
So, that's kind of wrapping up Bacopa. And next up is ginkgo. This one's probably pretty familiar to most of us, either from patients asking about it or from seeing it on the shelves in stores. But before we get into the studies, let's start with the basics. What is ginkgo?
So Ginkgo biloba is this large tree, has a distinctive fan-shaped leaf with a fruit and nut, and a long history of use in traditional Chinese medicine. But I think the question I want to know about, Andrea, is why is there interest in ginkgo to enhance cognition?
Yes, so that's where we talk about this preliminary data, specifically in vitro studies. They suggest that ginkgo leaf extract might be helpful for Alzheimer's disease and that it might help reverse the decline in certain brain receptor activity that occurs with aging.
Okay, well, that backdrop, let's turn to what we see in human studies. And we're going to start with the clinical research in our healthy adult patients. And they show that taking ginkgo leaf extract daily for about 3 months might improve some measures of cognition. That sounds a little bit familiar to what we were talking about with Bacopa. So we're seeing improvements in specific areas like immediate or delayed recall. But other research shows no significant effect on cognition in healthy adults, regardless of the dose or the formulation they used. What about any data in people with cognitive impairment, Andrea? What do we have there?
Yes. So there is a clinical study in patients with mild cognitive impairment that shows taking a specific ginkgo standardized extract for 24 months improves scores for cognitive decline and memory. However, it's important to note that these changes are compared to baseline, meaning we didn't have a comparator group to examine. And even though the changes were statistically significant, they may not have been large enough to be clinically important to patients.
Okay, well, that brings us to the part that sometimes really drives our clinical decision making when the efficacy is mixed, and that's pulling in our safety data. So, with ginkgo, it's really important to pause and ask patients, what else are you taking? What other prescriptions, supplements, over the counter medications? Because ginkgo does have many potential interactions with other substances. And I like this framework, Andrea, of thinking about 3 B's: bleeding, brain or neurotoxic effects, and blood glucose effects.
So I'll get us started with the first B for bleeding. You'll want to screen for interactions with anticoagulants and antiplatelet agents since ginkgo may increase bleeding risk. More specifically, ginkgo has been reported to increase bleeding risk in some people when taken with warfarin, possibly due to its antiplatelet effects. And even though the evidence is less direct, it's also a reasonable concern with other anticoagulants like apixaban or Eliquis, and with antiplatelet drugs like clopidogrel.
Yeah, and our next B is for brain or neurotoxic effects. That's because ginkgo seeds contain this ginkgo toxin, and large amounts of that toxin can lead to neurotoxicity and seizures. So it's important to consider that potential interaction for patients using, for example, anticonvulsant meds for seizure disorders.
And our last B is for blood sugar. In patients taking oral hypoglycemic agents, ginkgo has been associated with higher blood glucose after an oral glucose tolerance test, possibly because it increases hepatic metabolism of insulin. So it's worth being mindful of a potential interaction between ginkgo and other medications for diabetes and monitoring glucose more closely if someone wants to use it.
Yeah, so those three Bs kind of apply to some pretty common classes of medications, Andrea. I think it's fair to say if we're considering ginkgo, let's review the med list carefully for interactions.
Exactly. And our NatMed Pro is a great place to go for that. Our interaction checker is a powerful and practical way to input a patient's medication list and supplements of interest to identify any potential concerns.
So the bottom line here, evidence for ginkgo on cognitive function is mixed. The bigger issue for many patients will be potential interactions.
So, that quick check using the three B's is important: bleeding risk, brain seizure concerns, and blood sugar effects. So, review that medication list before saying yes.
All right, let's turn to our last supplement today, lion's mane. This one seems to be increasing in popularity, especially online, and it's popping up in different herbal blends. So give us the backstory on that, Andrea.
Yes. So this one's kind of a fun one. Lion's mane mushroom is exactly what it sounds like. It's a mushroom, and it grows on dead hardwood trunks. The fruiting body has a long history as both a food and a traditional remedy in East Asia. And visually, it's hard to miss. It's white with this shaggy outer texture made up of spines about 1/2 to 2 inches long, which is where it gets that classic lion's mane look. But again, we want to know, why is there an interest in lion's mane for cognition?
Okay, well, let's take a quick look at some of the preliminary data. And we have animal research in this case that suggests administering lion's mane mushroom as part of a diet for about 3 weeks can help prevent some of the learning and memory deficits that are caused by this amyloid beta. And that's a protein that we believe to be the driver of Alzheimer's disease.
Again, thank you, Jeff, for laying that groundwork on what this preliminary animal data shows. But unfortunately, that data in healthy humans hasn't been as promising. Not only are the clinical trials small, the results don't show a clear cognitive benefit, either acutely from a single dose or with routine use over about 1 to 3 months. And in one study, while the reaction time improved, word recall accuracy decreased and word recall errors increased.
Yeah, that's really interesting, Andrea. And I think you call out something there that we haven't really talked about with these other studies, but sometimes people are interested in these cognitive boosters as a single dose. So, particularly if we're thinking about those students, for example, they may be
Yes.
looking for that edge for performance on testing or something like that. And in this case, we're not finding that benefit. Well, let's take a look at data in patients with cognitive impairment. There's one study in older patients with mild cognitive impairment shows that lion's mane mushroom taken for about 4 months increased cognitive function, but the improvement wasn't maintained once the therapy was stopped. We also have some research in patients with mild Alzheimer's disease shows that taking lion's mane mushroom for about a year does improve some performance on activities of daily living compared to placebo. When they examine cognitive function, it improved scores on our mini mental status exam, but that improvement was only compared to baseline and not to placebo. So overall, the message really is that there is some suggestion of benefit. We're seeing some encouraging signals, but these studies really leave us with some key gaps in evidence for this to be something we could rely on or feel confident there's data for effectiveness at this point.
So, to kind of sum that up, in healthy adults, the evidence is lacking, but in
Mhm.
some studies of mild cognitive impairment and mild Alzheimer's disease, there's at least a hint of potential benefit, even though the studies have important limitations. Which then brings us kind of to this practical question. If a patient still wants to try lion's mane, what should we be watching for? So, Jeff, can you walk us through these again for safety and interaction concerns?
Sure. For these patients, I think it's important to tell them that lion's mane is generally well tolerated. Things like GI discomfort, nausea, and skin rash are possible adverse effects that have been documented. And there are some theoretical drug interactions. These are based really at this point on animal or test tube type data. And so, for example, with anticoag and antiplatelet drugs, lion's mane could increase the risk of bleeding. With diabetes meds, we could have additive blood glucose lowering. And with immunosuppressants, lion's mane seems to stimulate immune function, so that might interfere with the immunosuppressant drug or kind of counteract its effects to some degree.
So, just to confirm, you would advise caution for patients with autoimmune diseases like lupus due to potential disease exacerbation, and in patients using blood thinners for atrial fibrillation, for example, due to increased risk of bleeding.
Yeah, those are great examples and exactly the kind of places I think we would want to press pause. So, our bottom line on lion's mane, despite the buzz, it doesn't seem beneficial in healthy adults, and data are still preliminary with cognitive impairment.
But if they still want to try it, it's generally well tolerated. But consider that GI upset or possibility of a rash and use caution in patients with autoimmune diseases or using certain medications such as blood thinners.
So, quick spotlight. If you want to take this guidance further, NatMed Pro gives you point of care tools that can help make counseling more efficient and effective.
Particularly, a search tool to identify supplements and herbs with evidence regarding specific conditions. For example, you can search by cognitive function and review evidence in individual monographs. Also, an interaction checker, like we talked about earlier, to review drug supplement interactions in real time.
Plus, CE options and our monthly newsletter for ongoing updates and clinical pearls.
And the best news of all, listeners can save 10% with code NatMed1026 at checkout. Links are in the show notes. Now back to the show. So let's make this a real world consideration. A patient hands you a brain support blend that contains lion's mane and ginkgo, and they say, I'm on a blood thinner, but I want something for memory. Is this safe?
Yeah, so that's a moment to slow down and really assess what's in this blend, what medications are on board, and probably to gather some additional information about the patient as well. We know with ginkgo, for example, that bleeding risk, especially with anticoags or antiplatelets, is a red flag, and we have that based on human data.
And then they're probably also curious of, does this work? And I think that's when we need to set some of these expectations where evidence for cognition is mixed. And for lion's mane, the data in healthy adults mostly doesn't support the benefit.
Okay, so from a practical perspective, if this patient still wants to try something, I would help him evaluate a single ingredient first and steer clear of these combination products, at least from the beginning. So, for instance, we may want to talk to this patient, and if we learn that his desire is just to sharpen cognition, but he doesn't have any baseline impairment, that info would lean away from ginkgo or lion's mane because we didn't have good evidence in that healthy population. So we might have a conversation with him about Bacopa, sharing the fact that evidence there is really mixed. He may still prefer to give it, for example, a short-term trial and see if he is, in that small group of patients that might benefit. So we could talk through pros and cons of that. But whatever that decision is, I would definitely encourage him and any other patient to loop in all of their healthcare providers because these kind of interactions that can occur with supplements can matter even more than some of the hype that people hear about them.
I think it's a great approach to kind of look at each ingredient individually versus it as a combination.
Mhm.
And I also think this case is a good reminder that the idea of a cognitive boost is appealing. But for several nootropics, the evidence is still limited and inconsistent, as we've seen today. So, safety checks and then realistic expectations should kind of lead that conversation.
Exactly. And we can encourage our patients to focus on the basics to support good cognition. That may be better sleep, balanced diet, regular physical activity. Because when we're rested and feel good, our minds do work better.
So, on that note, let's wrap things up.
To claim CE, follow the instructions linked in our show notes. We've also included links to these monographs in the newsletter article so that you can bring these tips straight to practice.
Also, in the February newsletter, we cover another interesting and timely topic, cracking the code on eggshell membrane. And in our most recently published March newsletter, we dive into some quick takeaways regarding the new dietary guidelines and fibermaxine for colorectal prevention, which is very timely since March is Colorectal Cancer Awareness Month.
So follow or subscribe to this show in your podcast app so the new episodes land automatically.
And thanks for listening to Natural Medicine's Evidence in Practice, Evidence, Not Hype.
See you next month.